All right. Hey, everybody. Welcome to another Compliance Capers. I am accompanied by my very good friend, Betty Hovey from CHCS Consulting today. And again, it's the month of March, right? And we are talking about not only March Madness things, but we are talking about our OIG work plan. So last week we had dived into our background details, right? We really wanted to help all of you guys understand the nuts and bolts of what goes on in these monthly OIG work plans now that they shifted over to this new way of disseminating what they're doing, right? They do so much. Times have changed, right? Healthcare has completely changed. And so they changed the way they release this information to us. And it is once a month. And so for these next few episodes in the month, we really wanted to focus on actual closed reports. I really thought we thought together that it would be really instrumental in providing our audience with, some of our own interpretation of these reports in terms of what you and I see when we provide education, post-audit education to our providers. And in this particular week's discussion, we wanted to hit the nail on the head to our psychotherapy types of providers, right, Betty? So I know I myself personally am very excited for today's topic because I have audited many a psychotherapy code with documentation in my time. So I simply enjoy it. And I do still see a lot of issues currently in 2024 as well. How about you?
Yes. In fact, I recently had a case with a client that was, we were kind of fighting a take-back request from a payor when they were looking at some of their psychotherapy services, and some of the stuff in the report were some of the things that this client kind of fell into. So I think these reports are really good to take a look through and see all of the points that they're giving out and the tips that you can get out of it from looking at what the OIG has found, and then also to figuring out what CMS says they're doing about it.
Exactly. Because the OIG, these reports take them quite some time, right? I think I said this in last week's episode. These aren't conducted in a week. This particular report, I believe it documents somewhere in the 57 pages that it took them about a year, a little bit more. From July, it ended in the following December, so it does take some time to provide these details, again, because they are taking a rather large, stratified, random sampling of claims and coordinating documentation. And for this current psychotherapy report, yes, it does span multiple documents that are still not closed out, right? So let me go ahead and put a link up here for the audience on the actual general OIG work plan report. It is partially complete. So what we're going to talk about today is one of those documents that are actually completed. All of the documents, I believe there are maybe 4 links for work plan items that need to be closed out, and it states by 2024. So that's this year. Hopefully they will conduct all of the comprehensive reports that they wanted to do on psychotherapy services. And some of this does span through what was going on in the pandemic, right? So they will be talking about telehealth types of services as well in these various documents as well. And as you and I know, from these past 3 years in the pandemic, things were upside down in terms of billing requirements because our CMS did change things up all the time. Right? What seemed like all the time, especially that very first year in 2020, the guidances were changing rapid fire.
Yeah.
So it's a matter of them trying to figure out and seeing what providers were actually doing, right? Were they able to even provide telehealth
Yeah.
compliantly during that time frame, despite the waivers, et cetera, et cetera. So
Yes.
these types of reports really do get into all of that minutia as well.
Yeah, what I thought was interesting on this plan report too was that it covered both telehealth and non-telehealth visits. So it kind of, looked at both facets of it when it was putting the
Yeah.
information together. So some of them, are expressly, and that's the reason why they started it, was because of the telehealth. But then when you dig into the report, it also says, well, we also did 110 or 111, something like that,
Yes.
records that were not done by telehealth. So they did try to look at both sides and see it, was one way better than the other, kind of thing. And I thought that was very interesting on this report that, you pulled for us to discuss today too.
That's a great point, which again reflects on the complexity of the work we do, right? It is complex to review these types of not only psychotherapy services, but again, during the pandemic, right? So they are looking at both sets of service lines. Were these services performed via telehealth, or were these patients coming into the office, right? So the criteria are different. And the report does go into that. They in fact even asked providers that were involved here, they had them take a survey.
Yep.
They had a question list for these guys to respond to, right? To help them understand what to ask for,
Yeah.
right? And to see what they were doing during that time frame for their patient population, right?
Yeah.
Were the patients actually receiving this very critical and necessary mental health type of service lines, which in my opinion were completely critical, necessary, and crucial during the pandemic, right? Because I know so many of us personally have had people affected by mental health crises during the pandemic, right? So there's so much that goes into this one report that I happen to pull, but there are many, many others that this OIG report also highlights the fact that psychotherapy services in particular have been looked at over the past several years. They provide a page of that in one of their appendices on how much work has been done on psychotherapy services. And of course, all of those are closed out, and you can take a look at the number of, overpayment findings for psychotherapy services they have seen over these years,
Yep.
right? So their recommendations, in my opinion, are always very, very objective, and they really want the CMS to take a look at their advice, at their findings, and they want the CMS to respond to it, right? Like, what can you do? Can you put the edits in place? Will that be helpful to our providers? Can you, talk to all of the MACs? That's something I know you really want to stress highly, that, all of the MACs in the country, all 7 here, vary in terms of what they expect in terms of documentation for psychotherapy services. So that's pretty complicated, right? If all of them kind of say something different, a little bit nuanced, it's not all a national type of coverage, right? Like you have to follow all of this nationally. No, it's kind of all bifurcated out to the various MACs completely. And I thought this OIG report, like you had mentioned, is spot on. They identify each and every MAC is a bit different. And they do pose that question of, why? Is there a better way, right? Can we all have a kumbaya moment, come together, right? Get it all on the same sort of documentation checklist, which would help providers tremendously.
Yes. Agreed. Yeah. They, I think one of the things with when you were talking about the questions, the questionnaire they had them fill out, the report, in the completeness of it, they even give you what the questions were that they asked them to fill out. So
They
you can
did.
see the questionnaire they took.
That's right.
So when they put these out, they're always very thorough. And with this one in particular, there's quite a few appendices where they go through and give all that kind of extra information. And sometimes you can get as much information out of the appendices, as you can from reading through the report when you see all the graphs and the figures and stuff.
Yes.
That's where they give all the money stuff back there too, where they extrapolate everything. And, so you can go back there and see that kind of stuff too. So, and they break it down by what the errors were when they found them. So once again, you can see, okay, what was the biggest one out of the errors? Where do most people have trouble? Because this report, unlike some of the other ones, like one we're going to do in the upcoming one, that it was particularly about one specific place. This one is more of a national one where they're taking records from all over and pulling them together. So you can kind of see, is there like a national pattern here where most providers that ended up, part of this review, where most of them are having issues. So you can kind of target a little bit better, I think, for your own physicians and APPs, for their practices, by looking at some of these reports, by saying, okay, everybody seems to have a problem with these two things the most. So let's look at our practice and see if we're having those problems with those two things. So it really can be a useful tool in a practice to kind of zero in on where you may be having some targeted issues.
Agreed. And, in terms of the, general volume, right, of what they're talking about, they had mentioned something like $1 billion in calendar year 2019.
Yep.
Medicare Part B allowed approximately $1 billion for psychotherapy services, including individual and group therapy. Now, a prior OIG found that Medicare allowed $185 million in inappropriate outpatient mental health services, including psychotherapy services that were not covered and were inadequately documented, right? So right there, on that general link that I had provided, it states that very clearly, that that's the kind of number that they've already been looking at in the past, right? And a prior closed report already stated something very similar that this huge report found as well, right? So, when I see things like that, I'm like, okay, so there's still a need for continued education, right? If the numbers are still just as vast and the rationale is the same as reports that have already been closed out, I tend to see that my providers in this psychotherapy space need continued, reinforced education on emphasizing the details of, time has to be documented for psychotherapy services. So it's not good enough to just simply rely on the CPT code, to be brought over into documentation from your EMR, right? That just sort of pulls down in your practice management system. However it's done, I've seen this documentation, right? And it simply pulls the CPT definition. Like, for example, 90837, which they highlighted throughout this report as the highest number of findings that were incorrect, right? The most used services for 90837. Again, that's the highest level for 60 minutes of psychotherapy. So again, we know when things are that high, the highest, stage that you could possibly code to, they're going to take a look eventually at documentation, right? And so, based on documentation practices, you have to be able to have a start time or a stop time or a quantification of time, right? So your documentation has to say, I saw the patient at 1:30 p.m. and it ended at 2:35 p.m., right? You have to give exact start time, exact end time, or the general number, I saw the patient for 65 minutes, right? That would be supportive documentation. And in this report, again and again, they emphasized that fine minutia of total time or start and stop time were not evident.
Yep.
And so that is a continued problem, and it's been going on for a number of years as prior OIG audit reports have actually come out and stated. So,
Yeah. And I think that's one thing to note when they continue to pull something for projects over and over and over again. It's once they do something, especially if there's a large finding, they're gonna round back to it eventually and check it out again. I mean, just remember how many times modifier 25 has been on the work plan over and over and over. How many times consultations before Medicare finally said enough, we're on the plan over and over and over. So that's one of those things that if you see it, like in the appendix, I believe it's Appendix C that has all the prior ones on there. If it's on there that many times, that means there continues to be an issue there. And if that's the kind of practice y'all are in, you really need to be looking at these reports and really taking an eye, put an eye on your practice and audit your services and make sure, look at all the errors that were made in these reports. Are they the same errors every time? Are they different errors? And then look at your own records to see if y'all are having those same kinds of errors and, make sure you get on it, because as always, one of the first recommendations the OIG makes in these work plans is, we say that CMS should probably take this money back, and and CMS always agrees with that one. So they always say they are going to recoup all that money that the OIG found on their audits to be paid incorrectly. So you don't want to. It's not about getting paid; it's about keeping what you got paid. So just because you got paid for it doesn't mean you get to keep it. So keep checking on that stuff. And that's a good thing to use these reports as a guide for, is to see what's going on and what you need to look for specifically in your documentation.
That's right, Betty. Excellent. And not only do they agree with, facing the overpayments head on and going back and using their RAC auditors to go and recoup stuff, which they always do. This time, I find they've also taken heed to the extra provider education that is required here, because on a separate note, but similar to what we talk about here at Compliance Capers, is there are much more targeted probe and educate services that are happening this year throughout the MACs for psychotherapy services. So that's another, arm that the CMS has to provide this much necessary education, right? And so these types of OIG reports are taken seriously. So they agree to these terms, of course, on the recoupments, but they do see that continued education is a must. And so through these TPE types of programs, be it prepayment or postpayment, they will ask for documentation to see, hey, how can we help you? Fine tune your documentation to make sure that these claims are going out properly. So it can help you beforehand, so you don't make this next wave of OIG work plan items, right? Projects.
Yeah. And what I like, for people that have not been to take a look at, I know we were talking about, they'll post what their work plan projects are. So you can go and look and see, but a lot of times people don't take that extra step to see what the reports say. They're like, oh, they're looking at this stuff, but they don't go the extra step the stuff we're talking about, which is when they give those reports at seeing, okay, what did they find? What are they saying? And so if you look at one of these completed reports, and I'm just gonna, again, I'm a paper lady, so
let's look at Betty's sheets of paper, everybody. She printed all 57 pages.
I do. I'm old school.
I
So
love it.
they give a table of contents in every one of them. So you can see, they have the why we did this audit, all that kind of junk, but then it gives the findings and it breaks them down specifically to all the different finding points, and then gives the conclusion. It'll give you where the recommendation section is. It also gives you the CMS comments about those recommendations and whether they agree or don't with what they said. And then all the appendices with all the good stuff that's in those. And what I found interesting, if you look at what the findings were out of this one specifically, that the psychotherapy time was not documented, which you alluded to already, Sonal. Treatment plans were incomplete or missing. So, the assessment plan, what is are they going to have weekly therapy visits? Are you trying DBT? Are you trying some different kinds of things in there for the patient? No psychotherapy was provided or the documentation was missing. I always hate those.
Oh, no.
When they always say, like no documentation, there's no excuse for that, y'all. Don't miss those deadlines. Get stuff in when they ask you for it. Make sure you're submitting these records when you're being asked for them from these audits. Or psychotherapy services had incomplete documentation, the incorrect number of services or the incorrect CPT code was billed, and the provider did not meet incident to requirements. So we have the incident to rearing its little head again there. They also had a whole group where the provider signatures were missing. So the therapist didn't sign off on their notes. And I think specifically, out of the 216 total records they looked at, 31 of them had no signature. They just weren't signed. So that's a point that I've come back to a couple times with some of my clients. The record is not official, and it's not the service isn't completed until it's signed. And I know sometimes with some of these EHRs nowadays, I've had clients before that have called me and said that they got 100% denial on an audit they were doing because the payor is claiming that none of the records were signed. And when they looked into that, they said what they send, the copy that they printed out and sended, or that they saved and send it to the payor, just types the name on there. They didn't send the one where it shows electronically signed by with the date on there. And unless it has that in there, they don't consider that a signed record. So make sure if you are sending records somewhere that it is appropriately showing the electronic signature so you don't get dinged for it. Because that's one of those things where you're just like, oh man, it is there. And then you have to go back and redo it again. And it drags the process out further. And it just keeps that nervousness up in the practice. So make sure with those that the electronic signature is properly showing. I know that audit we did, some of those were like that, where we said it's not properly signed. And they had to come back and go, yes, they are. And, give us the record over again.
Exactly right. That's a great point, right? In this day and age, we have to be very, very smart and savvy, right? We have to be able to communicate with our EMR companies as well if there's some sort of a hiccup on their end where it's not actually capturing the complete electronic signature with date, right? That authentication is required. It's a must in today's times. Yes, we have the ability for an attestation, but that's if providers know. We don't want them to just settle and just say, okay, fine, I concede. I didn't sign anything. You know what I mean? We have to know ways that we can improve things, fix things properly based on CMS guidelines, right? So yeah, in this particular case, this report did state that for those particular items that were not signed, they did not consider those to be an overpayment. They did not put those into their greater bucket of what was to be considered an overpayment. They did, however, for the fewer services that did not meet the time requirements as well. So
Yeah.
those are still considered to be an overpayment. But yeah, the various charts and presentations that the OIG produces in the document are incredible, because that's where the juicy bits are, right?
Yeah.
Where, it's just a handful of services for psychotherapy, but they break it down and they illuminate how much time is needed to actually document
Yep.
that highest level, right? It breaks it down in there where your time needs to start, and where it needs to end. So I think it's just really helpful, if you happen to be a psychotherapist, right, and you need to clean up your documentation. This is a great handy tool that I would keep at the ready, and read it, digest it, and implement some of these compliant documentation styles. Like, let's say, for example, if you do happen to fall in the jurisdiction of a Palmetto GBA, for example, here in one of the appendices, they don't actually have any documentation requirements. There are 2 MACs that do not, at the time of this report, do not have any documentation requirements.
Yep.
But the others do. So, if your practice happens to be in one of these, MAC jurisdictions, you should be pulling up, as we advise from time to time on our compliance capers, you should be pulling up these MAC web pages that are incredibly useful, right? If they do have treatment plan requirements, like I think it's CGS, you should be making a small checklist tool for yourself at the practice and document, oh my goodness, I better have a treatment plan for each and every patient documented in my notes, right? So when I have to send my notes back to the MAC, to the CMS, in case of an audit, again, because you will be audited at some time in your practice, it's just a matter of when, right? So make sure you're documenting.
Yes.
These are great things that CMS does provide education on their MAC web pages, right? They really do. So be mindful, and be mindful of the current landscape, because again, this is 2024.
Yeah.
Maybe Palmetto GBA now has changed things up and they have a documentation checklist
Yeah.
on their webpage, right? This report is from the past. So we have to have someone on our practice teams that are diligent about staying on top of compliance, because, as we know, things in healthcare are never constant. They're forever changing.
Yeah.
So.
Yeah, and for those of y'all that do psychotherapy services, if you look at Appendix C in the report, it's on page 39. That's where they give you a breakdown of the different MACs and what they do and don't require for psychotherapy services. So once again, for my paper people, here it
Yes.
is.
Paper people, I'm scrolling through my PDF. Okay.
So it'll show, for instance, WPS and CGS require updated treatment plans in the documentation, but NGS, First Coast, and Novitas do not. Treatment plans must have certain elements, and they list which elements they expect to see. So if you're looking to template something for your EHRs, that these things are required in the documentation, doctor. For instance, CGS requires the type of service has to be furnished, the amount of services, the frequency of services, the duration of treatment, the diagnosis, and the anticipated goals all have to show in the treatment plan for that to be a valid session. So if y'all don't have those and you're under CGS, if y'all get audited, they would request that money back because it didn't have a correct treatment plan in it. So the record then isn't valid. So those are all things that they can use, to take stuff back.
And that would be where it would be considered insufficient documentation.
Yes.
Right? So great job. You sent everything that was requested, but you had insufficient documentation. That's what that very vague blanket term of insufficient means. Okay.
Yes. Yeah.
That's caught. Yeah, right? Exactly. Sorry, I didn't mean to stop you.
No, yeah, that's what I mean. So you can kind of go through, then it goes into what is required in the individual psychotherapy, what they expect to see. So you can just go through and look at the little checklist, the backside, for if it's group psychotherapy, what they expect to see. Again, Novitas for group psychotherapy doesn't have anything out there where they have requirements for you. So you can also see which MACs, are not doing things like that. And, that might be something where you may want to ask your MAC, if there are certain things that they just don't have any documentation requirements on, is that something maybe they could take a look at, so that you don't get into that where you're like, well, I have no idea what they want in the record, so it just goes through and gives you the interactive complexity also and psychotherapy limitations. So it's what isn't included in it. So maybe some things that you may be able to report separately, all of that kind of stuff is all in that one appendix. So those are good things. Yeah, that's the kind of practice that y'all have to go check out and to see what your MAC specifically is looking for.
Exactly. And, at the very basic level, like I think you stated earlier, we have to identify, why we're seeing this patient for psychotherapy. What is their end goal, right? We want to stabilize them. What does that mean in the psychotherapy space, right? So somewhere within documentation, we need to be able to see how many times is this patient going to be coming in for talk therapy, group therapy, etc., right? Frequency limitations, all of these types of things, psychotherapists have to understand are required in documentation to make sure that it's medically necessary, right? Again, which is the greater overarching theme of all CMS,
Yep.
conditions and services, is it has
Yep.
to be medically necessary.
Yep.
So, yeah, I really enjoyed reading this entire document
Yeah.
because I have a lot of providers in this space, right? And it's always good to, when you go in to audit them from time to time, it's good to see what their standards are, right? And what could be a little bit improved upon in terms of documentation, right? To make sure that documentation is supporting those claims that are being sent out.
It also puts some good examples in here of the
Yes.
things when they were auditing records, what they found. So that's something else that y'all will want to go and take a look at in each of the sections when, like I was saying before, how they have time wasn't documented or incident 2 wasn't followed, whatever it was. They'll also give examples of what they found in some of the audited records. Like they have one in here for the incident 2. A provider billed Medicare for a 30-minute psychotherapy service with an E&M service. Medicare paid for it. $56 for the psychotherapy, $56 for the E&M. They were billed under the MPI number of the psychiatrist, but the medical record for the enrollee day showed that a nurse practitioner did the service. So when the provider was asked, the response was that the psychotherapy service was not provided under direct supervision, which we all know is one of the requirements for incident 2. So the $56 psychotherapy service was unallowable, and wanted they that would be money they would request back to be rebuilt under the NPI of the NP, paying the pay cut. There's that whole process then you have to go through to get it paid properly, and maybe now you're out of timely filing. So there's all those things where just follow it right the first time, and you'll be okay. And I know we sound like broken records on this, but that's where these audits are so critical in your practice, to make sure you're looking at these things on a regular basis. You get a new provider, maybe they don't understand what all the coding rules are and the documentation requirements. And, they're listening to another physician or APP at the practice who maybe isn't so good at it either. So, the bad habits just kind of spread throughout the practice. You start doing a new service. Is it being done right? We think so. Well, we'll just keep go ahead and putting it out there until somebody checks on it and starts asking you for money back. So if you would proactively have as part, and it should be in your compliance program, which is required. Audits are required as part of that. So it should be just something that's in the lineup that should be being done every quarter or every 6 months, at the least annually. That you should have records looked at to make sure that these documentation requirements are being met, and that you're not missing revenue. We find that all the time where, things should have or could have been reported that the office didn't understand could be billed. So, that's another thing, or something that used to be bundled now is not bundled anymore, or vice versa. Oh, I'm sorry, y'all. My dogs are going banana pants. I really apologize. But that's why that's so important.
Yeah, I love it, Betty. That is so true. That's so well said. And we are broken records. We love that we are broken records, because compliance programs are a must. They are so necessary and vital to your practice. And yes, they're required, have been for quite some time.
Yep.
So yeah, that's why we sound like broken records. But, today's conversation with you, I hope, has been illuminating for everybody who's involved in the behavioral health space, right? From our certified coders, our billers, auditors, compliance folks, and our providers directly, right? There are ample opportunities to continue education. This OIG report that has been closed out is a great example to take all 57 pages, either electronically like I do or on paper like she does, and put it in your toolbox, right? Read it often, to understand how you can compliantly have documentation that supports those handful of codes that apply to the psychotherapy space. It's not the entire CPT code book. It's a handful of CPT codes, very manageable for you to get your arms around and understand how the documentation can better support these types of time-based services. It's a must. And, I know you and I can't wait for the final items for 2024 to finally be closed out. So the nerds that we are, we will go back and read these links and file them away in our toolbox for our clients. But, I hope all of you enjoyed today's Compliance Capers, because I know you and I could talk on for another hour on this very report. But I know it's a Friday and people have to go on with their busy, busy lives. But I really do hope that today's conversation with us has sparked some interest in everyone to go back and take a look at their own practices and make sure, as of the date today, you can start documenting that, oh, I listened to Compliance Capers and I'm going to make sure my signatures are authenticated properly. Yes. If I need to get in touch with my EMR vendor, I will.
Yep.
Find the nuts and bolts for how to document time, start and stop times better, based on today's Compliance Capers, right? There's so many things that we can do.
Great
advice. Betty, I wanted to thank you so much for spending this time today on Compliance Capers, and I know I enjoyed it.
Yeah, always fun. Thanks. And we hope that everybody's getting some good info and helpful things out of these. So I like doing them. So thank you.
All right. Well, I'll see you back next time, my friend.
All right. Thanks, y'all.
Thank you.